Good afternoon. Buenas tardes.
Buenas tardes.
Good afternoon. Buenas tardes, Ministra. My name is Ronnie Maza. I'm the Director of Planning, Budget and Evaluation Department here at PAHO headquarters. I am pleased and honored to step in for Dr. Ciro Ugarte, who cannot be with us today, as your moderator. Welcome to Room B, to this first briefing session. Let me acknowledge the head table, Dr. Barbosa, Director of PAHO, His Excellency Ambassador Tovar from Brazil, and Mr. Colin McClive here at the table, and my colleague, Dr. Alex Camacho, who will also be presenting to you. The agenda includes some remarks, and after the remarks, we will go to a video of the response to COVID. Then we will go to a presentation on the implementation of the recommendations of the external evaluation of PAHO's response to the COVID-19 pandemic by Dr. Alex Camacho, my colleague at PAHO. Then we will have an update on the intergovernmental negotiating body process and next steps by Ambassador Tovar da Silva, the Vice Chair of the INB group. Then we will have an update on the working group on the IHR process and next steps by Mr. McClive, Vice Chair of the working group from the USA. Then we will open for questions and comments to the audience and speakers. Welcome, delegates, once again, and we're happy to have you here. And without any, and those who are also joining by live stream, I'm told that this is being also transmitted live stream, so welcome to this session. Without any further ado, I will hand it over to our director for the opening remarks. Director Jarvis.
Thank you, Ronnie. I think that we have translation, the four languages, so please you can get the device and choose the language that you prefer. Honorable Minister, distinguished delegates, Ambassador Tovar, Mr. McCalvey, Alex Camacho, colleagues, ladies and gentlemen. Welcome to the first briefing session at the 60th session of the PAHO Directing Council, where we will have the opportunity to receive important updated information on the status of the implementation of the recommendations of the external evaluation of the Secretariat's response to COVID-19 pandemic, and the status and next steps of the Intergovernmental Negotiation Body, INB, and the working group on amendments to the international health regulations. First, I would like to recognize Dr. Carissa Etienne, my predecessor, good friend and PAHO's Director Emeritus, for envisioning and deciding in early 2022 to initiate an external independent evaluation of the Secretariat's response to the pandemic. I would also like to thank the evaluators, representatives from member states, partners, and our staff from across the various levels who participated and contributed to this important evaluation. This evaluation was conducted during a historical time for the organization and for the world. It is the first external corporate evaluation of the response to COVID-19 among all 6 World Health Organization regions, and the first comprehensive external evaluation of COVID-19 in the UN system in the Americas, and was published on the PAHO website on 15th June 2023, and therefore available to member states, partners, stakeholders, and the public in general. We will learn the lessons only if we make the corresponding adjustments and interventions in PAHO's Secretariat to respond to health crises more effectively, and also enhance our ability to anticipate the challenges, innovate, plan, and lead with resolve and resilience. To this end, I have established a working group from entities across the Secretariat to translate the 8 recommendations from this evaluation into effective and sustainable strategies and actions in line with our mandates. In December 2021, the World Health Assembly, as its second ever special session, established the Intergovernmental Negotiating Body, INB, to draft and negotiate a convention, agreement, or other international instrument under the WHO Constitution to strengthen pandemic prevention, preparedness, and response. The INB works under the leadership and consensus of member states based on the principles of inclusiveness, transparency, efficiency to incorporate the lessons learned from the global response to the COVID-19 pandemic in a legally binding instrument or accord that would provide a political commitment at the highest level through implementing an all-of-government and whole-of-society approach to ensure sustained and sufficient political and financial investment within and among countries. The 75th World Health Assembly adopted a decision to establish the Member States Working Group on amendments to the international health regulations to work on the proposal amendments to the IHR. Member States are discussing the synergies and complementarity of the WHO-CA Plus with the amended IHR and other relevant mechanisms and instruments to ensure alignment and consistency and to avoid contradiction, duplication, and overlap. Member States have a one-in-a-generation opportunity to approve a new instrument and the amendments to the IHR to set the basis of a safer world for all humanity. It is essential that Member States continue to engage actively in the deliberations in Geneva, ensuring proper interaction and alignment between their respective capitals and permanent missions there. PAHO will continue its technical support to Member States in the Americas to facilitate their meaningful participation in these both processes. Since the last meeting convened by PAHO on the INB and the IHR in July, general important meetings were held, and initiatives are ongoing related to preparedness and response. Last week, for instance, in New York, at the United Nations General Assembly, the heads of state adopted for the first time ever a political declaration on pandemic prevention, preparedness, and response, which is a sign of a great commitment for preparedness and response in support to the INB and the amendments to the IHR process. It's a historical moment, with many countries calling for learning from COVID-19 pandemic, equity, transparency, and accountability for future pandemics. Welcome once again, and I look forward to a rich discussion. Thank you for your participation. Mr. Mada.
Thank you, Director. Thank you, Director, for that message and that call for active engagement and the commitment of the organization to continue supporting member states. We will now have a short video on PAHO's response to COVID-19 prepared by our team. So we can go ahead with the video, please.
A mediados de enero del 2020, la organización
In mid-January 2020, the World Health
impacto de la pandemia por COVID-19. A través de sus equipos regionales y nacionales del Sistema de Gestión de Incidentes en América Latina y el Caribe, la OPS apoyó a los Ministerios de Salud y otras autoridades nacionales a ampliar sus operaciones de preparación y respuesta frente al nuevo virus. El Sistema de Gestión de Incidentes se organizó a través de 10 pilares de respuesta. Pilar 1. Coordinación, planeación, financiación y monitoreo. Apoyo a la actualización de 20 planes nacionales de preparación y respuesta para COVID-19. 498 millones de dólares recibidos por el secretario de la OPS para el apoyo a la respuesta a la COVID-19 de los países. Fondos recabados de una variedad de donantes y organizaciones internacionales. Pilar 2. Comunicación de riesgo. OPS trabajó con las autoridades nacionales en la comunicación de riesgos y la participación de la comunidad para combatir la desinformación y ofrecer lineamientos técnicos en comunicación y materiales en inglés, francés, portugués y español, así como en neerlandés, criollo haitiano y varias lenguas indígenas. Implementación de iniciativa piloto de la OMS para ampliar la participación de la sociedad civil y las comunidades en Ecuador, Guatemala, Guyana y Panamá. Pilar 3. Vigilancia epidemiológica. Publicación de 64 alertas y actualizaciones epidemiológicas sobre COVID-19 desde el 16 de enero del 2020. Apoyo a países a fortalecer la vigilancia a través de distintas redes y plataformas como EIOS, que fortalece la vigilancia basada en eventos, GoData para investigación y seguimiento de casos y otros sistemas como vigilancia basada en indicadores y vigilancia centinela. Desarrollo de herramientas de modelización y cartografía, y un portal GeoHub para visualizar las tendencias de los indicadores de COVID-19 para apoyar a los Estados miembros en la implementación de medidas de salud pública contra la COVID-19. Pilar 4. Puntos de entrada. Monitoreo de medidas de salud pública y requisitos de entrada para viajes y transportes internacionales. OPS sistematizó la información reportada por los países. Esta información aún se actualiza en línea y está disponible para todos los países. Pilar 5. Laboratorio y diagnóstico. Las Américas fue la primera región de la OMS en ofrecer reactivos de diagnóstico de laboratorio a los países y en abril del 2020, 28 países ya podían realizar pruebas del SARS-CoV-2 por detección molecular. OPS ha facilitado 22 millones de pruebas rápidas de detección de antígenos. Creación de la Red Regional de Vigilancia Genómica COVID-19, COVIGEN. Participan 33 laboratorios de 30 países y territorios. Se han compartido más de 600.000 especímenes del SARS-CoV-2 de América Latina y el Caribe a través de la base de datos. Pilar 6. Prevención y control de infecciones y protección de los trabajadores de la salud. 33 países y territorios reportan que cuentan con un programa nacional de prevención y control de infecciones. Más de 24.000 trabajadores de la salud y personas con mayor riesgo de exposición a la COVID-19 accedieron a información provista por la OPS. Implementación de programas de protección respiratoria en 10 países. Pilar 7. Manejo de casos, operaciones clínicas y terapéuticos. 300 equipos médicos de emergencia movilizados y 383 sitios alternativos de atención médica establecidos, generando más de 50.500 hospitalizaciones y más de 2.200 admisiones en atención crítica. Creación del Grupo Técnico de Oxígeno que apoyó a 28 países en fortalecimiento de capacidades. Acceso a medicamentos. Inimatrelvir, ritonavir. Intercambio de información de manejo clínico. 149.000 casos de la región fueron compartidos en la plataforma global de la OMS, que aún se encuentra en línea. Pilar 8. Operaciones de apoyo logístico y cadena de suministro. Apoyo a las autoridades nacionales para mitigar los riesgos de desabastecimiento y retrasos en adquisición de suministros médicos. La Reserva Estratégica Regional de OPS para Emergencias, localizada en Panamá, exportó 580 envíos entregando 1.624 toneladas a 37 países y territorios, incluyendo EPP, pruebas rápidas, entre otros. OPS ha adquirido suministros por valor de $851 millones a través de 1.236 proveedores. Pilar 9. Fortalecimiento de servicios y sistemas esenciales de salud. Participación de OPS en el Acelerador de Acceso a Herramientas COVID-19, ACT-A, ACT-A, y en el mecanismo COVAX, realización de 802 evaluaciones técnicas de suministros médicos para COVID-19, apoyo a la compra de equipos biomédicos y emisión de 284 alertas de autoridades reguladoras a través de la Plataforma Regional sobre Acceso e Innovación para las Tecnologías Sanitarias, PRAIS. Creación de la Plataforma de Innovación y Producción Regional para promover el desarrollo de tecnologías esenciales en salud. Trabajo conjunto con Biomanguinhos Fiocruz, Brasil, y Synergium Biotech, Argentina, para desarrollar vacunas ARNM y coordinación con mecanismos de integración subregional, organizaciones internacionales, fabricantes de vacunas y entidades financieras internacionales para fortalecer la producción de vacunas en América Latina y el Caribe. Pilar 10. Vacunación. Creación del Grupo de Trabajo para la Vacunación contra la COVID-19 en las Américas. En diciembre del 2021, 51 países y territorios iniciaron programas de vacunación que continúan hoy. Más de 153 millones de dosis entregadas a 33 países de la región a través del Fondo Rotatorio de la OPS para el acceso a las vacunas. 17 países de las Américas ya alcanzaron la meta del 70% de cobertura de vacunación COVID-19 al 30 de junio del 2022. 33 países recibieron apoyo técnico y financiero para adquirir equipos de cadena de frío, desarrollo de estrategias de comunicación para generar demanda y aceptación vacunal, incluyendo información para el público sobre la eficacia y la seguridad de las vacunas. OPS continuará dando cooperación técnica para ayudar a Estados miembros a adoptar un enfoque holístico de la respuesta a la COVID-19, con vista puesta en la preparación y la resiliencia frente a otras amenazas emergentes.
Thank you for that video. A lot to capture indeed in 7 minutes, and the 3 words that come out that I heard: collaboration, coordination, and commitment, but also capacity in countries that should serve the region well going forward. With that said, I will ask my colleague, Dr. Camacho, to give us his presentation on the implementation of the recommendations of the external evaluation of PAHO's response to COVID. Over to you, Alex.
Thank you, Ronnie. Distinguished Excellences, delegates, their director, colleagues and focal points from the IREP C19 implementation. On behalf of Dr. Ciro Ugarte, it is my pleasure to share with you the all of PAHO commitment on the implementation of recommendations from the evaluation of PAHO's response to COVID-19. If you allow me, I'll switch to Spanish for easy. Como ustedes conocen,
as you know, and the director has already mentioned it, in 2022, the Pan American Health Organization made a historic decision to perform an external evaluation on its performance as an organization in its response to COVID-19. This process, which was based on a very clearly structured methodology with commitment and involvement on part of the entire organization, not only did a review of over 100 documents and included surveys of almost 1,000 members, staff members of the organization, it also collected valuable information from a sample of 7 countries selected in the region of the Americas, which allowed it to identify what things worked well, and of course, what were those elements that needed to be strengthened. Important things that had to be strengthened, such as the management of events at the beginning of the pandemic, as well as the organizational response and structure, as well as the regional laboratory network, the early activation of emergency medical teams, and also those other matters pertaining to education and training, as well as other details that you saw in the previous video. But there were other major challenges highlighted in the report, which you can access through the PAHO portal. Those are the aspects necessary to address future emergencies and pandemics, such as matters pertaining to communication, the mental health and well-being of the staff members of the organization, and also how to improve interaction, not only with WHO, but also how to strengthen the work done with countries. Amongst the recommendations made by this assessment, and 8 very specific recommendations were made under the strategic, operational, and organizational levels. Under the strategic governance, the need to review and update institutional policies that provide for a much more efficient response. But also, it was noted that it was important to capitalize on all the progress made in scientific progress and in regional institutions, so as to be able to use all evidence and technological know-how to provide a more timely and efficient response. The financing and funding model was another recommendation, not only during normal times, but also during crises times and possible future pandemics, so that we need to diversify our funding models. Under operational, one cross-sectional issue was how to make operational and cross-sectional all matters pertaining to gender and equity across the board. Another recommendation made under recommendations 5 for operations was to disseminate in a more concise and efficient manner the incident management system, particularly by using it for long-term emergencies, as happened with COVID-19. In the area of innovation and digitalization, it was recommended to capitalize on the new technologies and methods recommended during the pandemic, such as artificial intelligence, the use of social networks to overcome resistance to vaccination, etc. And under organizational, it was recommended that we do an in-depth analysis of corporate management and internal communications for the purpose of use during crises. One of the most important issues, of course, are human resources. We found the need to have specialized personnel that can respond to emergency situations, and therefore it's important to review and revise the contracting policy, and particularly the area of mental self-care. Once the report was published on June 15th, the Pan American Health Organization's director decided to start a process for the purpose of implementation involving the entire organization, a process which would begin with communicating more than 100 focal points and setting up a task force that would work on implementing the recommendations, not only in the area of planning and preparation, but also in the operational aspect of it. As you can see here in this chart, various colors, they indicate the commitment and involvement of the different entities, not only at the central level of PAHO, but also at the country level. After a methodological review and prioritization process, of the 25 lines of action suggested, 16 were accepted and 9 were partially accepted. And later they were edited and converted into specific recommendations. The products we have for the moment, and many of you will recall the session of the executive committee that took place at the end of June, when we had just established the task force. And it's important to acknowledge the hard work done by all staff to prepare a plan of action that already has been reviewed by executive management. And as an additional product, the process manual. It's a process manual for implementation and will help in future implementations and experiences that occur within the organization. This work done by 24 entities and 17 country offices has resulted in 48 lines of action, key actions with 23 expected results. The process of implementing this has given priority to some quick gains without ignoring elements that have to be implemented over the medium and long term. They have responded directly to the recommendations we made earlier, and one of the most important has been to review and update institutional policy on preparation and response to future pandemics or similar disasters. Another was to expand everything that has to do with clinical intelligence networks, basically to provide support on evidence-based models. The funding is one of the major institutional challenges for the organization in order to ensure the sustainability of the process. Equity and gender, again, is a point that has been continuously and permanently highlighted. It'll be cross-sectional when implemented, as well as an effort to improve and adapt the management of incidents during long-term or prolonged emergencies in a crisis mode. But that cannot be done if those procedures are not updated and are not continuously tested as a permanent effort to be prepared and ready for health emergencies. Under organizational efforts, we worked on developing a new health platform and other elements that have to do with the continuity of emergency operations within the Pan American Health Organization. And one of the most important elements of this has been the human talent. So initially we set up a budget of almost $4 million, which is being reviewed, prioritized, and of course, the first steps have been taken to implement it in the area of execution. Right now, we are developing the implementation protocols with some activities that are underway, and we are also now involved in the monitoring stage. And the working group would be very happy to report to you any progress and challenges encountered. At the very beginning, I mentioned 3 elements that were considered to be part of the principles of this process, which were adaptability, flexibility, and consistency. And in spite of difficulties, and in spite of the very important agenda that exists to implement the biennial plan, we must acknowledge the work of each and every one of the 140 focal points that worked on this process. We expect to conclude this process in December 2024 with a final report and with application of it. At the very end, outside you will find a brochure where you'll find the full report, the full plan of action, as well as we are always open to any suggestions you may have. Thank you very much.
Thank you, Alex, and to our member states and delegates to show you how PAHO is translating these recommendations into concrete actions. With that said, I will now hand it over to Ambassador Tovar for his update on the INB process and next steps. Ambassador has a presentation. Welcome to the podium.
Thank you. Quisiera saludar a las ministras, ministros.
I'd like to extend a warm greeting to all ministers and delegates and to the PAHO staff for this initiative to have a briefing.
Chavez Barbosa for the invitation, but also for the outstanding work to bring the ideas, suggestions, and also the understanding of the whole of the Americas into the INB process. I think that we started some time ago, and under Dr. Chavez that was intensified, and we're happy to have in Geneva inputs, informed inputs from the region as we negotiate. You will see that we have now reached a point, I wouldn't say a point of no return because there's always a return, but we have reached a critical point in our discussions in Geneva, and especially after the sessions that we held in September, but also you have followed the high-level meeting in New York on the 20th. So we now are equipped with a whole history in the INB of collection of substantive elements. That was the first phase. Elaboration of a zero draft, and then the Bureau's text was the latest edition of a platform to help the negotiations. And now, when I look at even the name Bureau's text, and recall that there was a negotiation on how the T should be small and not capitalized, I realize that we now do not have enough time to waste on smaller issues. We have to concentrate on the very big issues that we have in front of us. But the Bureau's text was considered to be a useful tool to kick and to push the negotiations forward. And we were able to go through all of the parts of the future instrument during the sessions that we held in June. And recently, we started something else, was called the informal meetings. These informal meetings were devised by the Bureau and suggested to the INB and approved by the INB as a way to engage more countries into the discussions. Because up to then, the Bureau was the sole source of inputs and tools for negotiation, obviously under the strict guidance and help from the INB itself, and we did not create anything in vacuum. But at some point, we thought it would be necessary for more countries to be involved, so we decided to divide some of the critical articles that you have in front of you, 4 and 5, 9, 11, 12, and 13, and asked countries to help us on a double or triple region representation. So the first exercise, and I am pleased to acknowledge the invaluable work and outstanding performance of Mexico together with Norway in, as we call them, pioneers in this informal exercise to bring Article 9 about research and development to a stage that things are aired and discussed informally so that we can proceed to the next phase, which is the actual drafting of our future instruments. So that was very helpful, and we could not thank Mexico enough for that. We could also have a big round of applause for Colombia as well, because you see that Colombia was, together with the Philippines and Saudi Arabia, responsible for one of the key elements, Article 11, co-development and transfer of technology and know-how. You recall that there is a terminology switch. We used to call only transfer of and not co-development of technology. This is something that some claim that transfer would be somewhat neo-colonialist kind of term, because if you accept the fact that somebody else will transfer to you something that is developed, you're not taking part into this development from day one. So we introduced, but also we did not want to give the impression that we were doing away with the ideas and all of the agreements on transfer of technology and know-how, so we have both. That's the essence of Article 11, and Colombia played a very important role in pushing forward the discussion in an informal way. Australia and Ethiopia helped us with Article 12, maybe the most difficult article, that is access to pathogens and benefit sharing. And you will see that we were able to identify areas of convergence and divergence, but the divergence is maybe bigger than the convergence at this stage, but we're confident that we'll get there. There is an agreement that we should have something on access and benefit sharing. This something, the mechanism, how detailed, is up for us to draft. And finally, on supply chain, something that PAHO has a lot of experience and is in a position to help us, Article 13, we were helped by Indonesia and Pakistan. So those were the informals that were held in order to help us. The last one was in September, and we wrapped up all of these informals in a session that we held on Friday last, on the 22nd. So it's very fresh, and we could benefit also from the inputs from New York on the 20th. Now, what is the way forward? And this is, I said, critical time, because we are now in a position, and we received as Bureau, for those that do not know, I represent the region in the Bureau. We are 6, and I'm very honored to have been selected to represent the entire region of Americas into this Bureau. And so that I feel, coming here, it's not only a pleasure, but it's my duty to be here and be in constant contact with you. And I do that with a sense of duty also, of honor. So we managed, during the discussions of the last session of the INB, to receive as Bureau the mandate to elaborate what is now called a negotiating text. No capitalizing. There was one delegation that made a point to say a proposal of a negotiating text. Fair enough. So the idea is for the Bureau to present by mid-October, on the 16th, to be more precise, the first version of this negotiating text that will necessarily incorporate all of the discussions that were held during the INB sessions, but also, and most importantly, the very positive, constructive, and useful elements that came out of the informals from these facilitators that I mentioned before. And then by the end of the month of October, we should have all versions. I've insisted that although English is the negotiating language in the drafting group, it is necessary for all countries to have them all 6 official languages so that they could check with their capitals the best way to participate and react to anything that is proposed, and actually not only passively but also actively engage in the discussion. So unfortunately, with the difficulty with the calendar, we will only be able to promise circulating all versions by the end of October, because then we will have, and you see this timeline for those that have good sight and are able to read, we are planning the next INB, it's number 7, it's the third from the left, on the 6th to the 10th of November. So this is the next round of official engagement negotiations within INB. We'll probably, it usually opens up, you will realize that it's important to engage stakeholders as well, and you can only do that if you are at a formal INB and not drafting mode. When you shift to drafting mode, it's states actor only. So many countries have made a point that you need to at least brief them, and we have been doing that as Bureau, but also as INB, brief the stakeholders, the civil society, so that they know what's going on and do not only come at the very end of the process. And so when we resume the discussions and initiate INB 7 on the 6th of November, hopefully countries, we will have had a chance since the 16th of October onwards to examine what has been proposed and react and be ready to start the real drafting. When I say the real drafting is now we have a compilation of ideas, of principles, which is not enough for us to have a future convention or agreement. We need real legal provisions. I say that we talk about countermeasures, but now we need legally binding and some non-legally binding provisions. This is what we need in order to assure equity, acknowledge difference in levels of development, and many other issues that are essential. And I'm going to start with showing what I consider, but also from the collection of comments from the INB discussions, what are the main issues. And I'm happy to see that Pajo has already indicated that gender equality, the idea of catering for vulnerable groups, but most importantly also equity. Without this, we will go nowhere. So equity, human rights in general, gender equality, and vulnerable groups, prevention, which is the #1 concern from the PPR. That includes One Health, to what extent we incorporate One Health and the zoonotic spillovers. Climate change, it goes on for other issues like research and development that is also attached to the ability to increase local production and regional production. We've already mentioned the articles that touch upon co-development, transfer of technology and know-how. PABs, as we say, PABS, pathogen access and benefit sharing, supply chains, local production, and implementation of what we call acknowledgement of differences in level of development. You will see, for those that have had the time or even participated in the negotiations in New York, you will see in many of the 78 paragraphs the idea, particularly in developing countries. Sometimes they use a less fortunate language, which is not UN language of lower incomes. But mostly you have developing countries or to indicate that for some of the actions, you need to cater for that. We will have to do the same in our instrument. There's no sentiment that you need more than that. But if you do not that, you will fail to realize the fact that that's the reality. You cannot go on closing your eyes to these differences in level of development. This is a key issue. And obviously, we need adequate financing, new or not, or rechanneling of existing ones. So I'm also pleased and I'm happy to see Colin and acknowledge his presence here. He's been an outstanding supporter of putting forward this process with the best of our ability to allow the world to have an amended IHR. And we were finally able, as plenary meetings, we had as bureaus the occasion to discuss what do we do, how do we streamline and rationalize the work of both instances, knowing that there are very different mandates. But on the table you have proposals that are very similar. So you somewhat repeat some of the issues on both the working group on the international health regulations and the intergovernmental negotiating body. So we were able to hold those two meetings on the 21st and the 24th of July. We've been talking as bureaus as how best to gear the discussions in order to avoid the duplication. And sometimes duplication is necessary because one goes all the way to a declaration of a fake. And the INB needs a declaration of a pandemic in order to trigger the future provisions of the instrument. So they're not identical, but basically they should be able to rationalize our work in INB and WGA IHR, but also knowing that INB is Article 19 without prejudice to other articles of the WHO Constitution, and the IHR is Article 21. It's a regulation, not actually a convention or an agreement. We have benefited greatly from this exercise in New York. I must say that as member of the Bureau, we were not very happy at the beginning because we saw, for example, the movement of a group of countries in Europe to wash away, delete the word equity. So that was scary at some point. I'm very, very frank with you. But things improved in the discussions, and we called the co-facilitators in Geneva. We told them, look, if you're able to do anything that could help us and not stand in our way, we would be very grateful. And I think that's exactly what was produced, what was possible to be produced. You will see, I invite all of you to read this political declaration, which was very difficult to negotiate. I don't think anybody was very happy at the end, which is a good indication that it was balanced. But you will see that there are some elements, even, for example, in pathogen access, there was a recognition of the need to promote that sort of mechanism. Obviously, the language starts very strong. They manifest their utmost resolve, and then the verbs that go change. It's to promote, to urge, to engage. It's like any political declaration. You have a variety of actions that you can do, and that, unfortunately, in our instrument, in our convention, our agreement, we will favor commitments rather than just manifestation of best intent. This is why it's so difficult. So I'll also mention the G20 leaders declaration. G20 is obviously a very small group of representation, but it's indicative of already some arrangements that could come from the difference in views of different levels of development of countries. So we were happy that they also renewed their hope that the INB and the IHR would be able to go forward with the negotiations. So I think it was very welcome. As Brazil takes up the presidency in December, so in principle, we would be chairing the G20 as we agree on something in May 2024. So I think it was very good to see that in India we were able to have that renewal of expectation, or positive expectations concerning both INB and IHR. I will stop here, but I would like to acknowledge the help of your team, Jarbas, and if you allow me, also a big thank you to Ciro Ugarte, who has been a tremendous support of our exercise. Thank you very much.
Thank you, Ambassador, for that comprehensive update, including the key issues and key dates. Really challenging ahead indeed. And member states to be attentive to those key dates for input. We now hand it over to Mr. Colin McCliff for an update on the working group on IHR. Colin, over to you.
Thank you so much, Ronnie. Good afternoon, colleagues. Dr. Barbosa, thank you for having this event. Excellencies, ministers, colleagues, it's really great to be with you and to follow all the speakers. I just want to appreciate that we're having this discussion on the two negotiating processes while also hearing this really excellent update of what our regional office is doing to implement and to support all of us in our health emergency preparedness and effectiveness. And I think that's something that we should remember at the global level is when we're coming to these decisions and figuring out what to do, we need to create space and empower the regional actions, because this is where, in fact, the most coherent and effective and rapid responses really come is here in our region, not necessarily in Geneva. Not to say anything negative about Geneva, of course, but a very important process. So I just wanted to reflect on that, and maybe I'll pick up where Ambassador Tovar left off, just from the WGIHR Bureau perspective. It's been my privilege to serve as the Americas Regional Representative and Vice Chair for WGIHR for the last year as it's been conducting its work. I share the optimism and the positivity that came out of our joint plenary sessions, and I think, frankly, we need more of that. I'll go through in just a minute some of the upcoming work. Our next meeting, actually, of WGIHR is actually next week in Geneva from Monday to Friday, and we'll be taking up the last set of amendments, technical amendments, as well as some, I would say, more potentially politically charged amendments that we have in the group of proposed amendments through the discussion next week. But there are a number of joint topics that will come up next week as well. And I note even this week there's going to be a joint INB-IHR financing session. It'll be, unfortunately, 3 a.m. our time here on the East Coast, but in Geneva it'll be taking place to look at the landscaping of health emergencies. And I think seeing the minister from Guyana here and thinking about the pandemic fund, we have these very open questions in both negotiations, frankly. How will we tackle the financing aspects of what we're doing, whether it's strengthening new commitments and new obligations to cooperate under IHR from that sort of technical and regulatory perspective, or whether it's the new, hopefully significant and impactful political level commitments that we're collectively taking through the pandemic accord. Financing of that, none of that is going to be inexpensive, frankly. Preparedness is expensive. And so how can we do that collectively in a way that works, and how can we best take advantage of existing financing mechanisms and institutions, and what else do we need beyond that? So there'll be a look at that this Wednesday, and that'll be something that'll be a joint work between us. But just to give one other example, though, of some of the challenges that we face, there is a new Article 13A in the IHR that has been proposed by the Africa Group and Bangladesh that effectively would create an access and benefit sharing system within the international health regulations. And so I think Ambassador Tovar alluded to this, but I think whether it's in your reactions now, if you have time, or whether, over the next couple of days while we're here together with you, we would welcome feedback and guidance from you, from the member states, on how best to organize the time that we have across both negotiations. Just speaking personally as a Bureau member, but I think it maybe is a commonly held view across both bureaus. It's not necessarily productive. Sometimes there will need to be duplication, but it's not necessarily productive to replicate every conversation in both places with the limited time that we have. So I guess, again, very much would love guidance from this group on where we will go. I think there are some other issues that will be addressed next week, and I'll just go over some of them briefly for the group. So we'll be looking at next week's session. We'll be looking at the amendments related to points of entry and there are a number of amendments proposed there. We'll be also looking at Part 6 of the IHR on health documents and general provisions around those issues. And then, and those are the technical, more technical sets of amendments. And then on the more, well, I think there's technical aspects as well, of course, but also on the more political aspect, we're going to be looking at Part 1 amendments on definitions, purpose, scope, principles, and those types of issues, as well as responsible authorities. And so I think those are going to be challenging. I want to add my thanks to what Ambassador Tovar said, to the incredible team here at PAHO who has been sending out work. Tamara Montero in particular, who is officer leading for the International Health Regulations in the PAHO Secretariat, of course. I know they have sent out a lot of materials, including specifically crosswalking the technical proposed amendments that will be covered next week in the session, as well as with the IHR review committee elements, so that you can see those kind of independent review and look at those. So hopefully that'll be helpful for delegations as they prepare for their participation next week. The last thing I'll say, and then I'll close so that we can have more time, hopefully some time for discussion, is just on the way forward. Next week we have 5 days of negotiations, and then we have a WGIHR 6 in December that'll be a shared week with the INB there in Geneva just before the sort of Christmas and end of year holidays. And so the reality is that we're not going to have enough time to conclude, by December with the schedule that we have and at the pace that we have. And I think, as we've just both been talking about, there's quite a lot of interrelationship between the two negotiations as well. So one of the things that we're going to be looking at, and as a Bureau and as the Secretariat, especially WHO Legal Counsel, we're going to be coming next week with some proposals on a way forward. As you know, probably the IHR themselves require a 4-month notification period prior to the Health Assembly at which any amendments will be considered. They require that notification to take place 4 months prior in Article 55 of the IHR. One legal possibility is that the package of 300 plus amendments that member states have already submitted could constitute that notification. And we're looking at other options as well. But I guess the bottom line to share with you all now is that I think what we are hoping to do is to create space so that the WGIHR can continue its work in the new year as well, right up until May, as well as the INB will be working, so that we can have a comprehensive and effective set of amendments that also goes along, hopefully, with a strong and impactful and equitable new pandemic accord as well. And I think, again, the aspiration across the two bureaus, we're in the hands of member states entirely, but the aspiration is very much that both negotiations need to be successful for the other to be successful, and that, in fact, equity and greater preparedness and response effectiveness. So these are the goals, shared goals across both of the negotiations. So I'll stop there, Ronnie, and turn it back over to you. Thank you.
Thanks a lot. For that update and the request for that necessary advice on how to, I would say, maximize the input for both negotiations. Critical next week, indeed, and then the December meeting. With that, those presentations, delegates, we will open now for questions, comments. So please use your equipment in front of you to request for the mic, and then we will manage from this side. Again, if you just press once and hold it, we will know who is asking for the mic. We'll start with Antigua and Barbuda, Minister.
Thank you very much. Got it. Thank you very much. I really appreciate the comprehensive nature of the presentation, but I make it straightforward. If you were to give the top 3 ask, what would they be in order for you to be able to deliver consistent with the expectation of PAHO?
Thank you, Minister. We will now go to Paraguay. Let me see. Okay. Paraguay, por favor.
Honorable Director, distinguished delegates, and focal points. Paraguay underscores PAHO's decision to have subjected itself to an external evaluation as to its actions in response to COVID-19 and welcomes its willingness to implement the recommendations in order to ensure participation by all members of the organization. We prioritize prevention, and response to future pandemics aligned with the recommendations as published, emphasizing not only our health services, but also the communities and social determinants of health. The pandemic showed up inequities between countries and highlighted many of the existing gaps and made them deeper. We believe the voice of all countries is therefore essential to build actively a global document that truly leaves no one behind. That's why we urge that we work in formal meetings with all the languages available. Let me take this opportunity also to underscore that the future instrument, in Paraguay's view, should respect the sovereignty of member states and guarantee the leadership of the health authorities of the countries. Thank you very much. Thank you, Minister, for those words.
Pasamos a Chile.
I now offer the floor to Chile. Thank you very much, Director. Thank you for your presentation and description of the work being done and the external evaluation of the Pan American Health Organization. This is an extremely valuable exercise. It's valuable for the region, valuable for the countries, and could even be more explicit as to incorporation of primary health care in the work for preparedness, prevention, and response to pandemics, including other crises having to do with climate change. Ultimately, prevention for health emergencies are not only the epidemics and pandemics that we've been living, but preparedness for emergencies also, as done by the Pan American Health Organization, we think is a good model of how to work those two response areas together or jointly. This is an exercise that will not only help the region, but also the countries. With regards to the pandemic instrument and the agreement or convention and amendments to the IHR, as a country, we do see the need to not have a superposition of topics between the two documents. It's necessary to clarify the meaning of the pandemic convention and complement whatever is not covered in the IHR in order to look into equity, the development of capacities in countries, as well as technological development, not only the transfer, as well as economic support for preparedness and response, especially in the case of emergencies and more so in the long-standing ones. With regards to the IHR, we welcome the work being done on definitions. Having worked personally on this topic, I find that there are definitions that need to be clarified further. In the different regions of the WHO, they're understood in a different way, such as, for instance, the international element. When a public health, when a fake is declared, that is understood in different ways in different regions. There are countries or regions that understand this as to being international when it goes out of a region, or others, such as ours, that it becomes international when it crosses a frontier, a border. And that is not well described in the document. There is no definition, even under pandemic. So I think the text needs to be clarified. We're very grateful for having heard the synthesis of the discussion. It's very relevant. It's important for us all to be well informed, and we thank you both for really updating us on the status of both. Thank you. Thank you, Minister. Are there any further requests for the floor before handing back to members of the head table? There are microphones also for those not seated at the main table. So if anyone from the other rows would like to take the floor, Bolivia, you have the floor. Thank you, Director. The national plurinational state of Bolivia is very grateful for the effort carried out to prepare this pandemic instrument and all the INB negotiations where we've been present as a country. The discussion was very rich and tackling important topics, important for the region. The COVID-19 pandemic has shown that it's fundamental for the strengthening under equal conditions amongst all countries, emphasizing in particular developing nations, to ensure the strengthening of installed capacities in each country, financially support, transfer the appropriate technology in order to tackle future pandemic events. We believe is the only way that will make sure that this document takes life and helps all countries to address threats to public health in a more efficient manner. If we acknowledge that reaching the highest level of health for our people is the result of many aspects, without any doubt, the financial, sustainable, timely financing is fundamental for this purpose. COVID-19 left the region in the major health crisis that this region has suffered, and not only the region but the world. So there are valuable lessons learned that are reflected in this document in a very appropriate manner. When the pandemic began, most of us in all of our countries, felt that our health capacities were overcome, but also our financial capacities. Therefore, to address the pandemic was a major financial challenge for all, and all global strategies were valuable, although many of them were insufficient. Bolivia is extremely grateful for the support from PAHO throughout the pandemic, especially when they supported us through the COVAX mechanism to obtain the vaccine doses that we needed. Although we were had to wait for the arrival of the vaccines. And that is why Bolivia attaches great importance on the need for supplies as well as the supply chain, and vaccines and other consumables reach countries in a timely manner should there be another pandemic. At all times, we have to develop strategies to ensure sustainable financial resources in the case of outrages, emergencies, and pandemics. Diversification of the financing is crucial. In Bolivia, we have the human right to health in our constitution as a fundamental basic right, which is tied to the state's financial responsibility. We saw this during the pandemic. It was the prime priority for our government, and that's why we were able to tackle the pandemic successfully. It is still a priority state policy, therefore we continue planning to reinforce capacities for preparedness, prevention, and response to pandemics throughout the health system in our country, through the implementation of plans and programs that are assigned priority through the universal free health system with the approach of a single health, which is the policy of family, community, and intercultural health for our country. Once again, we are grateful to the team who worked on preparing this valuable document. We also thank PAHO's director for allowing us to share throughout this time the experience of all the other countries, because this has been a very valuable input for us. Thank you, Delegate, for those words. Colombia is now recognized, followed by Ecuador. We also wish to thank presentation of the report on the IHR and the instrument, and we truly appreciate the leadership in conducting an evaluation. It would be very good if with these outcomes from the evaluation we can implement mechanisms, bodies, and other groups, because there are different speeds. There is a schedule and there is an expectation to reach the end of the negotiation and amendments to the IHR, but there is also a speed attached to the situations of inequality, to the need for strengthening mechanisms in solidarity throughout the region. And the questions that occurred in the region when talking about the public, free, universal health service, it was mentioning that these ought to be a basic response, and I believe they have become priorities for the region. So with this mismatch of speeds, the climate change is actually highlighting the difference. There are situations not only of crisis but permanent climate emergencies. So looking at the 5 pillars presented by Dr. Jarbas in his strategic agenda, we feel that it's necessary to move forward faster and simultaneously with the development of these 2 instruments. With everything that is now viewed as a threat on the horizon for the region, every day we see the insufficiencies, the lack of capacity, and the need to act regionally. Thank you. Thank you, Mr. Minister. Ecuador is now recognized. Thank you very much. I do believe it's important to deepen some of the aspects of the evaluation presented to us, and I want to follow on to what Bolivia was saying. It is relevant to consider financing, to analyze the impact of the need for extra additional financing through different channels and mechanisms throughout the pandemic made a catastrophic impact on the internal health spending and this reduced the capacity to provide services, inputs, medicines, not only because of the time taken up and the resources being assigned, but it was a reduction to the minimum level possible of finances for the health systems, because it was difficult for them to regulate the financing for health services. So not only do we have to analyze how each country responded to the emergency in order to achieve financial sufficiency of their own budgets, but also how the international loans or credits were directed or how to give a new direction to sources from other ambits. But this has left us with low credit capacity, high levels of indebtedness. And should there be frequent repetition of this mechanism, it would become unsustainable looking at the financing of the health system itself, and this could be the public health system as well as the health insurance systems. So in developing these new documents, the analysis, the architecture of new financing mechanisms, there is need for a different vision. They must analyze, recreate these scenarios because they may reoccur in the future. Thank you, Minister. And we will be responding to these comments.
Presenters for some responses. I'll kindly ask Ambassador Tobar to start, followed by Colin, and then the PAHO Secretariat.
Gracias, Ronnie. I'll start in English with Antigua and Barbuda. I think it was directed to both of us, right? Yes. In our view, it's very difficult to just choose 3, obviously. But right. I'll be very careful in just concentrating. But for the future instrument, be it a convention or an agreement, unless it contains a mechanism for pathogen access and benefit sharing, we will not be transcending the current situation. So this is number one. If we have PABs is the way, we have seen this with influenza. The history of PIP framework, it's difficult to reproduce in totem, but it is a good source of inspiration. What we did for influenza has helped many countries use the resources that come from the payment. And for the pharmaceutical companies, it's not really a very heavy burden for them to contribute with these resources. So it solves the problem of financing, not solves, but helps in financing the re-equipment and the resilience of some countries that still need to identify, to be alert, to better survey, perform better surveillance. So PABs, or pathogen access and benefit sharing, is number one. Number two, unless we are able to actually increase local production, and regionally could be. And then this region is essential for that. And from north to south, we have many areas that could be, Central American, CARICOM. There is no reason why we should not have that locally, but also regionally. This capacity involves, obviously, transfer of technology and know-how and co-development of technology. This is something transcendental. Whether we'll be able to go beyond the TRIPS agreement, whether we're going to install waivers, I don't know. This is obviously more of a political nature. How big is this commitment? But this is essential, that we understand that we need more countries, more laboratories able to produce responses and medical countermeasures. And then, finally, we need a supply chain mechanism that actually guarantees what we call it is a timely, because if it's not timely, the vaccines can arrive or the therapeutics can arrive at a time when the person is already dead. So it has to be timely, affordable, because if it's too expensive, thank you, no. Also unhindered. We cannot be subject to any sort of measures that would not allow all countries to benefit from the counter measures. And obviously there has to be an equitable access to these countermeasures. So this element of equity should be included in many of the provisions. So it's not only one provision that would deal with equity. There's not only one provision that will deal with levels of development, but within the agreement, all these two principles should be present. So again, benefit sharing and pathogen access, transfer of technology, local production, and supply chain. And let me alert you, there is right now, we are running the risk of having a platform of medical countermeasure that is completely unacceptable, because it does not involve a full participation of developing countries. And we have been adding our voice to the need to not to reproduce what we see in the ACT, in the accelerator exercise. So when I say supply chain, it has to be from development of the solutions all the way to making it arrive. This is what we see as a decent supply chain and platform for countermeasures. Thank you. And pasando un poquito rápido.
I know we don't have much time, but let me switch briefly to Spanish. Thank you, Paraguay, for the comments. There is an evocation to the UN Charter and that of WHO, so thank you. And I make note that there is a need for all to be able to speak in our native languages and to have the text in all languages. The distinguished Minister of Chile spoke to the importance of primary health, and that is also part of more resilient health system.
Eso, gracias.
So thank you for reiterating that point. It also impacts the Brazilian workforce. Together with this, we also need to consider that the primary care take into account the social determinants of health. If we don't focus on difficulties in housing, access to water and sanitation, without all of that, we're not really providing fair right. It's not only equipping or to have a resilient workforce in health, but also to look at the situations in which these outbreaks occur. So the social determinants of health is part of the sustainable development, and we must not lose sight of it. Thank you, Bolivia. Bolivia has been very active in negotiations, and thank you very much. As Bureau, let me say we appreciate your efforts. All the points are properly noted. Thank you for repeating them here. Climate change, Colombia, this is very important, as you pointed out. It is with human rights, it's been in the negotiation of the document under the broader umbrella of sustainable development. And obviously, the issue that Bolivia and Ecuador mentioned, financing, it's difficult to know how much will be needed for preparedness and prevention to future pandemics. What we know is what is available today is insufficient. That is the starting point. So let me invite everyone to participate at the briefing at 3 a.m. as usual, having to do with financing.
Has to leave, so just a few remarks before I hand it over to you. Thank you.
No, thank you. I'll be very brief. I just want to make two comments. The first one is about the evaluation that we provide an update. Every year we will provide an update to our member states about the implementation of the recommendations, and I really thank Jimena Aguilera that before being appointed as minister was part of the external committee. I think that it's really very important topic how we can provide more integration to have primary health care as the first line for detection and response. Entonces, the second topic is about this process that both presenters, Colin and the ambassador, I think that provides an excellent update. I'm very proud to also say that we are the only region in the world that are having not only virtual meetings, but we have had so far 2 face-to-face meetings. And the 3rd of October, we will have another one. The 31st, and the 1st of November. I think that this will also be a very good opportunity because our role is not to advise, to make a recommendation. This is a totally country-driven process, but I think that is our role to facilitate. Because some countries in our region, they don't have a strong permanent mission in Geneva. The time of the meetings are not friendly for people that live in this part of the world. So I think that this is a very good opportunity to have 3 days with the capital, the Ministry of Health, Ministry of Foreign Affairs, because we are not only discussing public health, but a lot of diplomacy, political decisions. So we are inviting Ministry of Health and Ministry of Foreign Affairs, the missions here, the missions in Geneva. So I think that this will be a very important opportunity, again, to share information, to come together, maybe to identify some topics that the region will come together during the process and during the World Health Assembly. So thank you very much, but I need to leave to another meeting.
Thank you, Director. And if we can kindly ask for another 10 minutes so that we can address the questions. So, Colin, over to you.
Yeah, thank you, Ronnie, and I'll be brief. I know colleagues have other meetings to get to, but I really appreciate the discussion very much. And I'll begin as well with the comment from Paraguay around language. I think this is something for the IHR side as well. It is equally important, and we hear a lot, I'll be honest, in the Bureau from the Secretariat, well, this is a drafting group, and we don't typically translate or have interpretation and all of that. But I mean, the IHR, I mean, we hope that it will soon be two instruments, 2 legally binding instruments governing our collective global health architecture. But for now, IHR is a very technically dense and important document that every one of our countries, right, are implementing day in and day out. So I will continue to insist at every meeting that we have a translation and interpretation as much as maximally possible, because that is really a priority for me and for our Bureau as well. So just to assure on that point. Then I come, Minister, to your top three questions. It's very interesting. One of them is an overlap, actually, for myself and what Ambassador Tovar said, and that's actually the access and benefits sharing system. I think even though personally, I think that it actually does probably, and this is really doesn't mean anything because it's just my personal view. I think it makes sense to have it in the pandemic accord, but there's a way we could logically, if we have a PAB system in place, we could logically reference that in the international health regulations so that relevant surveillance and reporting requirements and those types of things could be linked to that. So there could be that assurance for countries that that access and benefit sharing regime is going to apply across both instruments. So that's one thought. The other thought actually picks up, Minister, from Chile, on your comments around definitions. That was actually my number one item, was the definitions around pandemic emergency, FAIC. If we decide to have, there are proposals on the table for an intermediate alert. If we decide to have something like that, what does that exactly look like? How is that precisely going to be implemented? And having that clarity on those definitions, I think, and having a system again in place that is clearly a coherent system. It's going to be, I think, every proposal I've seen in both negotiations is that it would always be the Director General who would be declaring, as it is now, either the FAIC or the pandemic emergency or what have you, but making sure that the rules of the road for the DG are very clear and we're all collectively comfortable with those. I think that is a really top three priority. And then the last for me would really be surveillance and what we can do with the IHR amendments to really clarify the rules of the road around surveillance. Again, linking in one case, of course, to the access and benefit sharing system, but also hopefully to greater capacity building. I would just note Article 44, and this is one where we have to do more work. Article 44 is a shall provision in the IHR. It talks about countries giving cooperation and support to one another, but it's very vague, right? And it's completely, there's not really any teeth in it whatsoever. And I don't know if we'll be able to get teeth with these negotiations. We can dream, but if we can at least have greater reporting requirements, greater clarity, so that countries have to actually demonstrate what it is that they're doing to support one another. Again, I would say, especially your neighbors, especially in your region, that is something that I think could be a very impactful change. And then lastly, just because I know we're at time, I appreciate several colleagues who talked about financing. I will say, as a person from my country's Ministry of Health, working with our finance ministry, both on things like the pandemic fund development and launch, and also in the G20 context, it shows me what the colleague from Ecuador in particular said, as I understood the comments, what we need to do through these processes is strengthen the systems. It's not only about generating more money for health, which I think is something that we all want to do, but it's also about making sure that the health systems and the health ministries can use the resources that they have as effectively and impactfully as possible. And so I really appreciated those comments around finance, and I think that's another area of work to follow up on. Thank you.
Thank you to both of you. And Alex, anything to complement from our side?
I will say I'd like to mention 4 takeaways very briefly, based on the comments and that were made. One of them is the importance on the strengthening in the policies that PAHO is not only committed with the institutional response framework, but also with the next PAHO strategic plan, where it is stated in the expected results also to cross-cutting all these aspects related not only equity and gender, but also the commitment of working very hard in the improvement of primary health care, among other topics that were mentioned. The other one is related the need and the importance of the work that PAHO is doing and actually is working on the funding model. I'm not the expert in that topic, but what I can assure you is already PAHO working on the Pan American Sanitary Bureau funding model, so it can be strengthened also the response to public health emergencies in the future, and of course providing technical cooperation in timely and efficient manner as well. And the other part is the operational part, related specifically to the performance of the Pan American Sanitary Bureau during emergencies, and also how are we not only taking the lessons learned that was really, I will say, a tremendous effort of the IMS team, the incident management team that worked for more than 3 years, and I will really extend an applause for them, because it was really a huge commitment. But of course, we need to adjust some aspects related to the administrative aspects that must be taken in place during protracted emergencies specifically. So, and of course, this is an ongoing process. The implementation of the recommendation is flexible, adaptable. So please, it is also open to the public. That's why we are sharing the report. So please, we are more than happy to take all these suggestions. Thank you so much.
Thank you, and I need to close this meeting because the other one will start. So I'd like to thank you, Ambassador, Mr. McCabe, delegates, ministers, everybody who participated. Just to note that the Secretariat will put a brief report on this so that it can also help our member states in the follow-up. And we will continue to facilitate, as the Director already highlighted, the regional consultations, and so that we can have the regional voice and the country's voice going over to Geneva. Thanks again, and have a good afternoon. Thank you.